Hello, and welcome to the Stem Cell Healing Institute podcast. In case you have any questions regarding this program, please write us at info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome back to the Stem Cell Healing Institute podcast. We are here once again with Dr. Sara Figueredo. She is the Research and General Director of the Institute, and she is currently in Canada. How you doing, Doctor? How are you?
Great. Thank you so much, Louise. I'm doing really well. Yep, visiting Vancouver, my hometown, and seeing some patients, and just getting a lot of things done, trying to cover all my grounds. So yes, here we are doing a podcast from beautiful Vancouver.
We are glad that we reach you all the way in Canada, but we are doing this podcast for you guys. So if you like this podcast, please recommend it. Doctor, we do have a very interesting topic today, which is stem cells for arthritis, for the degenerative arthritis. Is that correct?
That's right. Degenerative arthritis. Very, very common, very common in so many patients. And we have a high number of patients that come through that we do stem cell therapies for degenerative arthritis and different types of arthritis as well.
I think we're going to start with the basics. I'm going to ask you, what are the stem cells? What are stem cells? Yeah.
What are stem cells?
Yeah.
Yes, absolutely. Let's start with that. Sometimes we just take for granted or assume that listeners know what stem cells are. So it's a great basic question, Luis. So basically, stem cells are it's like a progenitor cell. It's a cell in a more primitive state where it can regenerate itself. It can regenerate itself. And adult mesenchymal stem cells are regenerative, and they can basically help to build tissues or construct tissues or regenerate tissues, and that's what we mean by renew or regenerate themselves, and that's what stem cells can do. They're also anti-inflammatory. So for many conditions, I mean, almost every disease condition is due to some degree of inflammation, or it can cause some degree of inflammation. So they are anti-inflammatory. They are regenerative. There are so many components to stem cells that are so healing to the body.
Okay, and of course, if you have arthritis, stem cells can help. In this case, do you apply those stem cells locally or intravenous?
Yes, that's a great question, Louise. We get asked that a lot. You know, with degenerative arthritis, which is also known as osteoarthritis, there is that degeneration of tissues, cartilage, sometimes soft tissues, sometimes tendons, ligaments. There is which is either caused by normal wear and tear and aging or overuse, or also injury. And now those tissues are basically regenerated, reconstructed by the stem cells. And so, yes, that's what's going on. Is the stem cells we apply them locally, and we with a combination, a cocktail of stem cells. It's a proprietary cocktail of stem cells, growth factors, whatever we feel is necessary for that patient and the condition, and we do inject it locally. And then in some cases, depending on the patient and what they want or what they need, we may do IV. But for the joints themselves, because there's such a limited blood flow into the joints, we don't get the stem cells to where we need them to be if we put them only IV. So we have to apply them locally.
I see. And what will be the current status of the studies or the effectiveness of the stem cells?
Of the stem cells for degenerative arthritis? That is again a very good question. You know, Louise, our treatments, because of everything we do with the stem cells and how we apply them, unless it's a very, very severe bone on bone and just, where the patient just needs a replacement, for instance. If it's a severe bone on bone and a lot of damage to the bone, there is a chance that we can help with the damage to the bone. But if there is absolutely no cartilage to build on, the results can be limited. However, that's where our screening process comes in, because we will not tell a patient that we can get them better if we know we can't. So it's really important that we have images and we do this screening in order to deduce whether or not a patient will benefit from stem cells. And I will tell you, most patients will benefit from stem cells. We have had almost a 100% success rate with our osteodegenerative osteoarthritis and degenerative arthritis patients. And when I say a 100% success rate, it means that we have seen improvement in 100% of our patients. Sometimes another follow-up treatment may be required to see further improvement. But with most of our patients, we have reduced or eliminated the need for pain medication, which is quite phenomenal. And we have a pretty good track record where that's concerned.
And you do these treatments here in Guatemala, right?
That's right. That's right. We do them in Guatemala because these are not these types of treatments are basically outlawed in Canada and the U.S. The way that we do them in terms of combining the stem cells into a beautifully formulated, very effective cocktail, that is not allowed in the US, nor is using stem cells from outside of the patient's body. So another source of stem cells like endometrial or umbilical cord cells, those are not allowed in the US. Only the patient's own autologous stem cells are allowed without in any combining them with anything else that makes them so effective. And and also, the stem cells can't be manipulated in any way or grown in a lab, expanded, it's the technical term, to get higher numbers, because numbers and viability, the effectiveness of a stem cell is very limited or the treatment is very limited when the numbers aren't high enough, nor if the stem cells are living and viable. So we ensure that all of that is in place before we do a treatment to ensure results and effectiveness.
Great. So, doctor, can we say that the goal of the stem cell therapy for arthritis is what? What will be the goal?
Yes, so definitely reducing pain and the need for pain medication, which is so common. I mean, the number one reason that patients come to see their doctor is for pain. And so reducing pain medication or eliminating it, which is the goal, eliminating stiffness, muscle weakness because of lack of use and muscle atrophy, which is the technical term, as well as the painful cracking that we hear in the joints. All of this is reduced or eliminated with and inflammation. And inflammation and swelling is reduced or eliminated with stem cells. And we're literally going in there and regenerating or reconstructing damaged cartilage, damaged bone, damaged soft tissues, connective tissues like tendons and ligaments. Depending on what the specific issues are for the patient, we will address them directly and very specifically.
So, therefore, the mobility will be improved for sure, right?
Oh, yes, absolutely. Yes. That basically translates to better mobility, better quality of life. patients can start doing things that they haven't been doing for years, because they can move. They can move better without pain, and move more without pain.
Does this require more than one visit, doctor, or have you had results on only one visit?
Yes, absolutely. Well, it depends on the degree of damage. So, if we're looking to a close, something close to a bone on bone with very little cartilage, again, it also depends on the patient and the lifestyle. But we have seen results and stop after one treatment. There may be instances where the damage is so severe that a lot of pain is eliminated. The use of heavy duty pain meds is eliminated, but the complete elimination of pain hasn't been attained yet. And so, in that case, if the patient feels that they need more, which most of the case they don't, they feel that, hey, you know what, I'm doing pretty well with this, and I'm okay with this. So a follow-up treatment isn't required. But in very severe cases, a follow-up treatment may be required.
And just so the patient knows how long this treatment takes, because they might think it might be like a week or of treatments or something like that. What will be the range time of each session, doctor?
Mm-hmm. That would take it would take us about 7 to 10 days in Guatemala in order to do the pre-treatment protocol, which is all of the workup before the stem cell treatment itself, before the stem cell injections themselves, and then a few days post recovery. However, there isn't much of a downtime at all. In fact, with most of the treatments, where it comes to degenerative arthritis and osteoarthritis, if it's in the knees or the lower body, we want big weight bearing activity. So we don't want a patient to be completely sedentary. Um, and so there's not much downtime. And so after 2 or 3 days post treatment, they can be on their way. So 7 to 10 days is maximum for a patient to be in Guatemala.
And if you come to Guatemala, we can provide all the facilities as far as lodging and one-day trips as well, doctor.
That's right. Yes, we provide in our treatment package. We provide accommodations as well as a personal driver, and if a patient and their family or their companion require any sort of touristic adventures or experiences, we can make arrangements for that as well.
Is there anything else you would like to add, doctor, to this podcast?
Perhaps just reiterate that Guatemala is a beautiful destination country. A lot of people don't realize that or know the extent of tourism in Guatemala, but it is quite a phenomenal place with the active volcanoes, coffee farms, the Mayan ruins. It is just a beautiful plethora of landmarks and beautiful tourism locations and locales. So
And it
we hope
is
to.
it is a very modern city as well. In case you are wondering, we do have
That's right.
we do have a Starbucks here.
Yes, that's right. That is I'm glad you brought that up, because so many of my patients, when they come, they are really impressed with how advanced we are. And it's quite interesting, because in so many ways, where it's very progressive. Guatemala is a very progressive country. So we're proud to offer Guatemala as a destination place for our amazing cutting edge therapies.
Okay. By the end of this podcast, you will find all the information how to contact Dr. Sarah Figueredo. Or if you want to send us an email, you may do it by sending an email at info@stemcellhealinginstitute.com. Doctor will receive your email and she will reply as soon as we can. Doctor, Thank you once again for being here on this podcast, and don't miss our next podcast, which is gonna be the topic will be diabetes, stem cells for diabetes patients. So thank you very much once again, doctor.
Thank you, Louise. It's been wonderful talking to you again. You take care.
You too. Bye bye.
Bye.
If you want to contact us at the Stem Cell Healing Institute or Dr. Sarah Figueredo, you may do it by calling us. In North America, you may dial +1 209 690 7836. Also, if you want to write us by WhatsApp, you may add +502 4220 7297. Please send us an email at info@stemcellhealinginstitute.com. And don't forget to visit our website, stemcellhealinginstitute.com. Also, if you like to recommend our treatments, you may find us on Facebook at Stem Cell Healing Institute. Please follow us on Instagram at StemCellHI. If you want to recommend this podcast, please refer to anchor.fm/stemcellhealing. Also, you may find us with that very same name on Spotify. If you want to watch our videos, please go to Dr. Sarah Figueredo, that is on YouTube. Thank you.